Hello and welcome to Amanda's Wellbeing Podcast, a podcast where we discuss all things relating to your well-being, including interviews with experts in the fields of nutrition, physical and mental health, and my 5-minute Food Facts series. I am Amanda Hayes, your host, a lawyer turned nutritionist with a passion for well-being. Before I introduce today's guest, I will mention that although I will often be speaking with experts, any information or advice provided in Amanda's Wellbeing Podcast is not intended to be used to treat, cure or prevent injuries or medical conditions and is not a substitute for advice from your own health professionals. Today I am here with veterinarian Dr. Chris McComiskie. In Australia, we love our pets. Did you know that 61% of all households have a pet? 40% of those households have at least one dog, which makes it the most popular pet in Australia, followed by cats, then fish, and then birds. Today, Chris and I are going to discuss how owning a pet can enhance your well-being. So I'm very, very excited to be here with fellow animal lover, Dr. Chris McComiskie. Chris, you're a veterinarian. And when did you know that you wanted to work with animals?
I think these are the type of questions where you expect me to say I wanted to do it for my whole life, but it's sort of didn't start that way. I think as a young child, I think there was always a fascination there. I remember I used to go to the library with my father and my siblings, and I used to rent out all the animal encyclopedias.
Oh, really?
I'd take them home, and Mum had a scrapbook for me, and I used to plagiarise and trace all the different articles, and so I had my own sort of little animal encyclopedia at home. So I do that every week. So there was always something there, and I also remember fondly at times with my brothers where we'd kind of collect, lizards and spiders and frogs and do our best to care for them, often failing, but doing our best. So yeah, I think it was just a fascination as a young kid. But when I was in year 10, the careers counsellor told me that I probably wouldn't achieve results that were good enough to get into the veterinary degree. So he suggested I do something to do with sport, which was my other passion.
Right.
I was never going to be a footballer. So I started physiotherapy, and I did it for 6 months. I hated it.
Really?
It wasn't for me. And so the second 6 months of that year, I actually started doing work experience at a vet clinic around the corner from my house. And my job there was dog grooming, washing dogs, and I found I had to talk to the customers about their dog, and I found I really actually enjoyed those conversations with people, and so I applied and got into vet school the year after, and that was that.
Oh, well done.
Yeah, it's convoluted, but yeah.
Yeah. So you obviously had an ongoing passion, and it came to fruition as an adult.
Yeah.
Then going on to study it, how long does it take? What's the course like?
When I completed it, it was a 5-year double degree, and the kids now have to do 6.
Right.
So it's a long time.
Yeah.
The first, for me specifically, it's about 10 years ago now. The first 3 years was just like a Bachelor of Science. So I wouldn't say it was too different to other Bachelor of Science type degrees. But the last 2 years is pretty full on. You're at university 8 to 5, Monday to Friday, and then on weekends you're working in the vet hospital there,
right,
overnight. So it's a full-time gig for 2 years, and it's pretty intensive.
And as part of that degree, do you learn surgery on animals, or is that a separate thing?
No, well, you do. So you learn a lot of theory. But learning theory is very different to doing it.
Yes.
You have some within the university that I went to, Murdoch and Perth. They had a connection with the RSPCA there, where we helped de-sex rescued pets. But it was you'd be lucky to get much more than maybe one cat de-sexing or one dog de-sexing before you graduated.
Right.
So some kids were fortunate in that some of their work experience places would let them do quite a lot. But myself, for example, I left university having done one cat spay, and that was it.
What's the next step then? How do you then get to the point where you are qualified to do that?
Well, you're qualified.
Yeah, okay, qualified.
But you need to get a good job.
Yeah, sure.
You want to look for a new grad, and I tell new grads this all the time, you want to look for a workplace that doesn't have just one vet. You want a really supportive vet clinic, and I was fortunate enough to end up in one of those places.
Yep.
And you learn it all on the job, and you don't get thrown in the deep end. I was lucky enough, I was basically supported surgically for, probably the first 18 months of my career, and I still learn now,
Yeah.
It's always different.
Oh, that's fascinating. I didn't know that about veterinary science. There's probably lots of other things I don't know about it as well. I want to ask about your current practice, but quickly before I do that, do you have pets yourself?
Yeah, probably too many.
Good answer.
Kate and I, we have 3 cats. They've all come from vet clinics that I've worked at, and we have a little dog, and we have 2 turtles, and I think we have maybe 6 budgies now. And
wow!
Most of the budgies have come from work too. So, if sort of no owners come forward, then they sort of end up in my aviary.
Oh, that's lovely.
Yeah, so there's a lot of animals. We don't have a big place, so we're at our max. And Kate and I, we've banned each other from bringing home more rescue animals because they end up being permanent animals.
Yes, I'm sure they do. So your current practice, which is where I met Chris because he cares for my much-loved dog, Lenny, is the East Side Vet. And so when did you start in that practice?
I purchased the business in December 18, which doesn't feel like that long ago, but it does at the same time, if that makes sense. Before that, I was a fly-in, fly-out vet in Alice Springs. And then before that, I worked a very long time at a clinic down south of Adelaide. And
so how does it feel then to have your own practice? Are you enjoying that?
I do enjoy it. Sometimes I don't know what I'm doing. And from a business point of view, I think I'm a good vet, but I'm sort of learning how to run a business on the go. I'm lucky in that I've got really great support staff, and I've got a pretty great clientele, and that I obviously inherited when I took over the practice.
Yeah.
But I think I'll be here for the next 30 odd years. So I hope.
Oh, that's very good to know. I've spoken to a lot of people on my podcast who are running their own business, and they all, without exception, say what a steep learning curve it is. As you say, if you've got the right people around you, then that's the key, I think.
Yes.
What services do you offer at your clinic? Do you see all animals, or do you have certain types of animals you do and don't see?
I'm a small animal vet, so I'll see lots of dogs and cats, but we'll also see rabbits, guinea pigs, lots of birds, reptiles, and a bit of wildlife here or there, which we accept and treat if treatable. But I sort of wanted to develop a clinic that was providing modern medicine, but we still wanted to maintain that family clinic environment.
Yep.
And it wasn't too sterile. So we're working on that.
Oh, it's great. And I guess in the introduction, I said that Australians are great pet lovers, and I think 61% of households have a pet, and the most popular or most common pet is a dog, followed by cats. What, Chris, are some of the most rewarding things about your job?
I think the obvious answer is, it's a privilege working with animals. I think that is a privilege, as it is to own an animal.
It is.
But I think what is the most rewarding, I find, is the positive impact you have on the humans attached to those animals, which is probably not something as an undergrad that I really thought about. And it may be something as positive as treating an animal from illness to health, or it may be spending the time with the owner to help them making the decision to allow their animal to pass peacefully. And that, it's odd, but that can be rewarding too. When you've done a good job helping that family through that experience. And
making that decision, because obviously it's a very hard decision to make, because you have to try and detach the emotion a little bit and work out what's the best outcome for the animal. So, that leads in nicely to then the next question. Well, what is the most challenging or difficult aspect of your job?
One thing I struggle with and is the occasional misconception that vets here that we are motivated by money, we should do it for the love, and all those sort of comments which are fairly negative. But the reality is good quality medicine is expensive, and there's no Medicare for pets. And we do our best to work within the means of the client, but it sort of has to be understood that you need to survive as a business and pay your staff. And if you're working within limitations, which you might have to, then it might be challenging to arrive at a diagnosis or to appropriately treat an animal. We might know all the things that can be done, but if we can't do all those things, it can be quite tough. And that's part of being a vet. You work within the means of the client, but it needs to be understood on the other end as well.
Yeah, that's a good point. I hadn't really thought about that. I thought you were going to say putting an animal down.
Well, that's hard, but I suppose I'm not worried about doing that when it's the right time, and yes. I think we're privileged to be able to make that decision, So I don't. Yes, it is emotional, but is that the hardest part of my job? I don't know. I don't think it is.
When you were in veterinarian school, did you have any counselling or teaching about how to approach clients in that way, or is that really just something that you learn on the job?
Maybe a little bit like the surgery. I do recall there might have been a couple of lessons. But I don't remember them that well, but I'm sure there was something. You need to be empathetic, and you need to be able to adapt to different scenarios. Some euthanasias are planned over several weeks for an animal with a terminal illness, so you see it coming in, you can plan it. Other times it'll be a poor dog that's been hit by a car that needs to be put down very quickly because they're in a lot of pain, and you can't fix it. You just need to be aware that every situation is different, and the interactions with clients in those different scenarios will be very different. And
yes, of course.
And I think yes, you learn that as you go. I don't think there's anything in a textbook that says specifically how you need to deal with different people and different scenarios. And some people will need you to just physically be there to be supportive.
Sure.
Other people will need you to be very verbally supportive. And I think, again, that's just something you learn when you learn about people. They don't really get taught about people. You just sort of, you learn that as you go.
Yeah, no, very interesting. And the reason I asked that question is because really the crux of what I want to talk to you about today is the link between owning a pet or being involved with a pet and how that can enhance our well-being. And one example is that Beyond Blue, which is a not-for-profit organisation that supports people with mental health problems like depression, they have a whole page dedicated to pets and their impact on mental health. They say pets can support you in unspoken ways. They provide companionship, unconditional affection. They bond with you, and that supports mental health. And I think that's really true. I mean, certainly from my own experience of owning pets. So, Chris, I assume over the years you've probably seen thousands of pets and their owners. And so, as a general observation, do you notice the benefits that pets have on their owners' health and well-being?
Yeah, absolutely. At Eastside specifically here, I have a fairly old clientele base, and I'm not referring to you. We have a few retirement homes down the road, and I will often see a gentleman or a lady who comes in with their little fluffy dog, and they will say to me, my partner's passed away 6 months ago, and this little dog is the best thing that's ever happened to me.
Oh,
it's that time, and they will be totally obsessed with this little fluffy thing, and that's, I imagine, helped them with the grieving process of, losing someone they've been with for, say, 40, 50 years, and these little dogs help them through that, and they will openly talk about that.
Yeah.
And I guess if you even think about current times and COVID restrictions and lockdowns and the sort, and a common comment would be, thank God I had Fluffy here with me, because I wouldn't know what to do during those 6 weeks or whatever it was. And interestingly, there was a puppy and kitten purchasing boom during COVID.
Oh, really?
You can't even get puppies and kittens at the moment. They're all gone.
Oh, that's fascinating. Yeah, I mean, it does make sense, doesn't it?
Yeah, well, in May and June at Eastside, I saw more puppies and kittens than I'd seen in the previous 8 months.
Actually, just anecdotally, a lot of friends have posted pictures of new cats and dogs, puppies and kittens on their Instagram. So yes, I guess, we're seeing it.
It's Australia-wide. Like it's commonly spoken about amongst veterinary, chat groups and the sort.
Do you think that, I'm speaking specifically about probably more dogs than other animals here, do you think they can pick up on their owners' moods?
I think we know dogs can, they can recognise human facial expressions.
Mm-hmm.
So yes, but I think we don't give enough credit to cats.
Yeah, see, I don't really know much about cats, so tell me about cats.
Well, I do know there was one study. I don't know heaps of details regarding the study, but it was in 15 in the US, and there was 12 or so cats, and they were basically assessing the cats' behaviours to their owners when their owners were smiling, a positive appearance. And these cats were found to be more likely to need and to purr and to sit on their lap and to just stay around versus their owners frowning and looking very negative. And I know that's not a heap of science behind that, but I do wonder.
Yeah.
And you think about, like, even in the consult here at work, if I have a client that's particularly on edge or anxious or really outwardly stressed, it's not uncommon for that pet to be the same.
Yeah, very interesting. They pick up on that.
Panting and on edge and not sitting still and really examine.
Do you think that if we talk about some of the ways that pets do enhance well-being, there's some obvious ones like, walking your dog, that keeps you active. It gives you perhaps routine in your life. What about the social connection of people that own animals? What kind of things do you see there?
I think if you think about two strangers that are outside, right, and they're having a walk, and if they both have a dog, then they immediately have something in common. There's a common ground. So that social anxiety of talking to a stranger is completely removed. You just talk about your pet. And I find that even myself in consult, it's really easy to talk to my clients even if I don't know them because we have something in common.
Yeah.
We both have dogs or cats, and so I think there is it's a great conversation starter, and there's a group of ladies that come see me that regularly will go to the local dog park and catch up every Wednesday or Thursday, whatever it is, and they really enjoy that, and I've actually managed to get a few clients that way because they go and they talk about their pets and they talk about which vet they go and see, and they meet, so absolutely.
Yeah, I mean, I have found that myself. If I go out for a walk alone, you just don't stop and talk to people in general, do you? But if you're with your animal, with your dog, in my case, you're right. People actually stop and talk and you can form bonds. And I always have this presumption that if someone has a dog with them, they must be a pretty decent person because they're looking after their animal.
I think that's a fair assessment.
Yeah. I also read about a study, Chris, and I'd be interested just to hear your thoughts in general on this, that it was an epidemiological study where they showed that children who grow up in households with dogs had a lower risk of developing autoimmune illnesses such as asthma and allergies. And the theory is, I mean, I guess they don't know this for sure, but the theory is that the diversity of microbes that these animals bring inside the house sort of work in combination with our own immune systems and strengthen them. So do you think that sounds like a likely reason?
I think there's merit in that. You think about, like, I know when I was a little kid, my parents would encourage me to play in the dirt or play in the sandpit at playgroup. That sort of theory was the reason why. And there's other studies. I forget where it's come from, but there's one to suggest that with a newborn baby living with a dog the first year of its life, they're less likely to develop respiratory illnesses. Yeah. So I'm sure there is merit in that. How to prove that point, I'm not sure. It's all anecdotal, but I'm sure.
Yeah, I mean, these studies, the study I mentioned was epidemiological, so it's not a proof, but it's it's sort of, there's a link. Yeah. And what about if a dog licks you? Should you wash your face or what?
if I did that, I'd be washing the skin off me.
Yeah.
I wouldn't say go around and let dogs lick your face. I wouldn't encourage it, because you can get some nasty bugs or parasites,
worms or something.
You sure can, so I wouldn't recommend it. But my dog licks my face, and it happens, and I'm pretty well, I believe. And
you've probably got a super immune system.
I hope so. I wonder.
As you might know, I enjoy reviewing wellbeing related books. On the topic of things that can have a positive impact on mental health, such as pets, as Chris and I are discussing, a book about creating abundant well-being and emotional balance is Apples for the Mind by clinical psychologist Dr. Tom Neame. In his insightful book, Dr. Neame provides practical tools to look after our mental well-being in ways that will help to decrease the chances of mental ill health. Many of us look after our physical well-being and pay attention to what we eat, but how do we look after our minds? This topic that Dr. Neame has researched is his passion and is beautifully presented in Apples for the Mind. I'll insert a link to my review in the show notes where you can also purchase the book if you wish. Also, if this topic interests you, please listen to my interview with Dr. Neame in episode number 16. And now back to my discussion with veterinarian Chris. Chris, if we talk a little bit about working dogs, they can contribute, as you know, to people's well-being in such a variety of ways. Some of them, like guide dogs, for example, receive very specific training. My brother-in-law has a guide dog, so that's something that's very close to my heart. And they are also useful for people in institutions. I think there's been some studies on prisoners where they had dogs in a prison in the US, and the incidence of violent interactions went down quite a lot, or significantly. And also they have in Victoria, they have a system called trauma support dogs, where people who are victims and have to give some difficult evidence in a case will have a dog with them, and that often helps them, relieves them of anxiety and helps them to talk. So I'm just curious to know, Chris, about these dogs that are trained as support dogs. You often see Labradors. Are there specific breeds that are more adept for those kind of roles?
Yeah, it has to be. You probably wouldn't put a little Jack Russell Terrier into those roles. And I'm not being breedist, and I'm sure there are some very calm Jack Russells. But yes, your Labradors and your Golden Retrievers, they're great support dogs. They have a patient demeanour. They're overtly friendly, and they're great learners. So you have to choose the right breed for those types of things. And in terms of like the trauma support, people with PTSD also find dogs very helpful, and I think it's because they are gentle, they're intuitive, they express unconditional love, but they also do that trauma support you were talking about. It's probably because they provide a sense of calm and safety and comfort just by physically being there.
I think one thing I love about dogs is that dogs just love their owners almost no matter what. You could be a violent criminal and your dog would still love you.
Correct. Yeah, absolutely right.
I wonder if they're more intelligent than we give them credit for. They probably are.
I probably agree with you.
Yeah. Chris, so we're talking about the different breeds of dogs. So different breeds, I believe, have different characteristics. Like, as you say, you wouldn't make a Jack Russell a guide dog. You'd be running in zigzags all over the place. So can you give us some examples of various different breed types and what some of their traits or characteristics are?
We think about Kelpies and Border Collies. So essentially they're historically farm dogs. They're obedient, they're nimble, they're intelligent, but they're workaholics, so they need a purpose.
Right.
They're best suited for active families, or someone invested in, I suppose, like training and activities.
Yes.
If you have a tiny backyard and you are very busy and you purchase one of these dogs, you will probably end up with one that's anxious, restless, destructive. It'd be a nightmare, and that's not the dog's fault. That's just because the environment is suited to its personality. So they're all different. You think about terriers, which is relevant to you. You're busy, big terrier, they're hardy dogs and they can be stubborn, but they're still smart and they're pretty relentless when they have a problem to solve, and that's why they were used for hunting, for little creatures down holes, or if they're too big above ground,
Yeah. Relentless. That's a very good way to describe my dog. I think, therefore, what I'm hearing is if someone wants to own a dog, they need to do a bit of research into the type of dog that fits into their lifestyle.
Absolutely.
Yeah.
Like a lot of research,
Yeah. What about those huge dogs, like, say, the big ones I can think of are Irish Wolfhounds and Rhodesian Ridgebacks. I assume big dogs need more space and a lot of exercise. Is that a correct assumption?
Maybe for Rhodesian Ridgebacks, yes, but for your huge deerhounds, your Great Danes, I wouldn't say they need a heap of exercise.
Okay.
There's certainly regular stimulation, but they're not on the same level as your border collies and kelpies that need to run for hours on end. And if you think about greyhounds, for example, greyhounds don't want to do a whole lot.
Is that right?
Yeah, they're happy just to be. You still walk them, of course, but you don't. You think because they're an athletic-looking dog, you'd have to do a whole heap. But yes, they're bred for running. But when you adopt one of these dogs through the GAP program, you'll see that they don't want a whole lot. They're happy just to be.
Oh, that's interesting. I would have assumed that they would just want to run all the time, because that's really what you associate with a greyhound. Chris, there's also different types of dogs. So there's obviously the purebred dogs like a Labrador and a Poodle and an Airedale Terrier in my case. There are mixed breeds where mum and dad might be different. And then there are, I don't know if this is the correct label, but sort of designer dogs. So can you tell us about the different sort of types of dogs?
So a purebred is basically when the parents and the ancestors have come from one breed. Okay, and there's usually papers or a pedigree associated with that. And those dogs will usually be part of some sort of, I suppose, breed-related dog club. In terms of your designer breeds, that's sort of breeding two purebreds together. So like common at our work is Labradoodles. Yep. You might see tons of them. I guess the benefits of purebred dogs by themselves is you know what you're getting. So it's easier to research and you sort of know what to expect in regards to what is required to look after them, what sort of health conditions they are likely to get, all those types of things. Whereas your mixed breeds are just sort of a mixture of a ton of things.
Right. It's a bit more random.
More random. And they're sort of the dogs that I've grown up with.
With a mixed breed where they're breeding a Labradoodle, do you start from scratch every time, or can two Labradoodles have a Labradoodle, or do you always have to go back to the original mixture?
I believe you can, and don't quote me on this, but I believe you can go Labradoodle with Labradoodle.
Okay.
I'm not sure they have to go back to the start of a Labrador with a Poodle every single time.
Yeah, no, I really don't know. It's like a mule, isn't it? Like they can't breed themselves, but what are they? A horse and a
donkey.
A donkey, that's right, a donkey. Yeah. I wondered if it was like a mule. I just didn't know that. For people that do have pets, dogs and cats, can you give us a couple of tips on some training for them? Like, what are the things that you should start with when you have a new puppy and also when you have a new kitten? Like, what kind of things should people do?
If I can say the one thing that's most important is you want to adopt positive reinforcement training. So you sort of it's teaching an animal to perform an action in order to gain a reward. So you can sort of mould or change a behaviour by rewarding the behaviour you want and ignoring the one that you don't. And this reward could be like, because you've got to find something valuable. So it could be a treat, which is usually what it is, a treat. Or it could be verbal praise. It could be pats. It could be playing fetch or another toy. I think often we make the mistake of using negative reinforcement, which we never should. And negative reinforcement, that's so say you yell when they do the wrong thing, or you smack, or you tap on the nose, or you use a spray bottle, which people still often do, especially for cats. And sure, it's going to make that pet run away from that behaviour at that particular time, but all it's making that pet is probably head shy. and anxious. And I will see that in a consult when I try and examine that pet's ears or look in that pet's mouth or go to pat that pet, So I think you just adopt positive reinforcement only and never negative reinforcement. It's not two things I know, but that's probably the key.
So basically you're saying you ignore the negative behaviour, just don't acknowledge it, just ignore it.
Well, you sort of redirect it. So say the negative behaviour is a big one's puppies that mouth. So puppies will mouth. It's what it's in their nature. Part of that might be teething, sure, but sometimes it's just play behaviour. They do it with their litter mates, right?
Yeah.
But if you allow that mouthing behaviour to continue, then it might become a 25-kilo dog that's mouthing. It is not suitable. So, you're not going to, when they're doing it, you don't yell, you don't hit, you don't grab and push away. You will either stand up, walk away and ignore that behaviour, or you will redirect it to a toy, for example.
Okay.
Instead of your hand.
Yeah, sure. Okay.
And when you are playing with that pet, say it's a dog, and they're not doing that naughty behaviour, you positively reinforce that. So you sit, you stay, you have a treat.
Yeah. And what about with cats? Are there things owners should do for when they have a kitten?
Well, it's trickier. I must admit, but it's the same fundamentals really. You need to find something that kitten finds valuable, and again, when it's doing naughty behaviours, you don't negatively reinforce them. You ignore them. That might involve walking away. It might involve waiting for them to do the right thing and giving them a reward for that. But harder. It's hard. It's
harder, but it's the same principle.
Yes, same principle. But I reckon cats know cats are stubborn.
Yeah.
Cats are trickier to train, I appreciate. I do wonder whether cats are smarter than dogs. I'm not sure yet.
Yeah, I don't know.
I wonder.
Is there any truth to the, you often hear that and I may get this the wrong way around, but it's better to have a cat first and then a dog, or the other way around, or does it really matter what order you get them in?
I don't think it matters, as long as when you bring the new pet in, you respect that the other pet was there first.
Sure.
And you give the pets time. And what I mean by that is you don't just pop them in the same room together on day dot. It's just going to end in a nightmare. If it's a puppy or a cat that was already there, the puppy's just going to want to chase the cat until the cat stops, and the cat's going to want nothing to do with it. And it can be vice versa. So it's just respecting who was there first, and then gradually introducing. That might mean separating in different ends of the house for a little while so they can get used to the sense or the smell of that other pet being there.
So you ease them in.
Yeah.
And also, Chris, I'm just personally curious about this. I've read that dogs don't like being hugged, like sort of coming over their back. Is that true?
I think if you don't know the dog, of course, you wouldn't do that.
No, it could be dangerous.
I think if you try to hug from front on and go straight toward them, I think that is confronting and stressful. In terms of petting and hugging, I think as long as you're not really squeezing and enveloping them, I don't think it's a big problem. But you just sort of don't go straight at the face and don't, if they're sort of struggling with whatever you're doing, you don't force the matter. If they're
sure.
They probably don't want it. So you read those cues, and you also read other cues. Does it cause that dog to start panting and licking their lips? Are they showing other sort of nervous behaviours? So their eyes wide. So you just have to read your dog. I hug my dog.
Yeah, well, I hug Lenny, my dog too, but in a gentle sort of way. I don't squeeze him because he wouldn't. I mean, he'd start growling if I did that.
Like a nurturing way. You do it in a nurturing way, just like you would do it in an infant. You wouldn't squeeze too hard.
So what are the signs then that your dog is nervous or anxious? You mentioned licking their lips or their nose. What else do they have? Panting?
They'll lick a bit more. They might be panting and their eyes might be wide. They might be rigid and just restless,
Yeah, okay.
And I think what a really important thing is if a dog is wagging their tail, it doesn't necessarily mean they're happy.
So is that right?
I see lots of nervous dogs in consult that are really nervous and that are still wagging their tails. Okay. And it's the same with kitty cats. Kitty cats will purr when they're comfortable, yes, but kitty cats will also purr when they're stressed and when they're anxious.
Oh, okay.
I'll have a kitty cat on the consult table and, he's purring, you must like being here. And I know full well that cat isn't enjoying being here, so the purring can be something to show their anxiety.
So I guess for you, you must understand the other signs as well.
Correct.
So
Yeah. Right.
And do you think some pets are drawn to certain people? I always find, for example, that I don't know why, but maybe other dogs always come up to me, but maybe they go up to everyone. I'm not sure.
But is it the way you present yourself? Like we talked earlier about facial expressions. Do you appear to be a happy and accepting person? A dog's not going to come up to someone that looks angry and loud and has an aggressive stance. Whereas you look quite gentle. So are they drawn to certain people? Well, I suppose so, but they're probably reading our cues.
Reading this, yeah. Well, dogs always make me smile, so I always smile when I see a dog. So maybe that's the cue I'm giving. Chris, I don't know whether you'll be able to answer this question given how many pets you have, but are you a cat or a dog person?
If you asked me 10 years ago, pre-owning cats, I'd probably say dog. Now, the cheating answer is I'm indifferent. So I don't have a favourite at the moment.
Yeah.
I love cats. I grew up in a family that was very dog orientated, so I didn't know cats that well, but now I know them and I like them, and I sort of like their personality, and they truly believe that we are slave, they are master, and I don't know, I like that about them.
That cool confidence that they have.
Absolutely right. And they're all the same.
I've really grown up with dogs and would say I'm a dog person, but I'm certainly not averse to getting a cat. Maybe next time I see you, I'll be coming in with my cat.
Yeah.
Although from what you said before, there's none available.
They're hard to find at the moment.
Yeah. So in terms of COVID-19, then what adjustments have you had to make in your daily practice to accommodate that?
We're probably a little bit more relaxed now than we were at the start of the year. We're still cautious, which I think you have to be. And at the start of the year, when it all hit off, and we had to change our practice policies quite significantly. And this is where my support team was excellent, because they're the ones that had to sort of implement that.
Yeah.
So we had to make a few rules, like we weren't allowed to have more than one client in the building at once, because we're a small clinic. So we'd have to coordinate that. So owners would have to call when they arrive, and then we'd have to call them back when the previous client had left. And so there was a lot of messing around for the receptionists, and we stopped handshaking, which is something I used to always do, but we still don't do that. Obviously, the hand hygiene is something that we were already doing a lot of these things, but we sort of really pushing it and providing the sanitisers for customers as well. And the trickiest one I found was we made a rule pretty early on that anybody that was showing any cold or flu symptoms was simply not allowed to be in the clinic. And so the guys would ask that question over the phone, and most people were understanding of that, but very occasionally, we had a few times when someone would still come and they'd be in the waiting room and you'd hear them coughing and spluttering and sneezing. And I know it's just cold, but the reality was that we then had to sort of kindly...
that's awkward, isn't it?
It was horribly awkward, So it was a tricky time, but now we're sort of, again, we're a little bit more relaxed. So when I say that, we're not ignoring the fact of what's still happening elsewhere. So yes, we're still not handshaking, we're still sanitising our hands, we're still, talking to clients about where they've been. And
as far as I know, animals can't contract COVID-19. Is that true? Do you know?
There needs to be a lot of research before you sort of give definitive answers. Okay. I do know that some felines and big cats as well as domestic cats have tested positive, but the thought is that they're not contagious to a human being.
Right.
There's another thought that indirectly, like if you say you pat an animal that's been petted by a human with COVID, you can indirectly contract that way.
That's just through the surface touching, not the animal being sick.
I think early on there was a Pomeranian in Hong Kong, I think, that apparently had COVID.
Oh, right.
And apparently got it from an owner. But again, like we're talking about very, very, single type cases. And so there's not a whole lot of research done at this stage for me to sort of give definitive answers. But I do know, like, a lot of the recommendations, not so much in Australia, but overseas, is if someone in a household has COVID, then the pet should be separated from that person as well as the rest of the human.
Oh, I see.
Yeah.
Chris, thank you so much for talking to us about pets. We all love our pets. And just a few questions to wrap up. So who inspires you, Chris?
It's probably a very sort of wanky answer, but it would have to be my parents, and I think
it's a wonderful answer.
The reason being, I guess, is my parents. I had 5 siblings, and my parents managed to raise us all reasonably well, I think, and that was off a high school teacher's salary, and that was it. And we all managed to go to good schools, and we've all ended up with really good careers, and that must be how we were moulded. We know that, and so I look back at that, and I think I don't really know how they did it, because me and my brothers were terrible, and I don't know how they did it, but it's quite an incredible feat.
That is wonderful, isn't it? And so where did you come in the family?
I was the first boy, second child. I was the second boy, but my first brother died as a young baby. But with the 5 of us that are still here, I'm the second along.
Oh, well, that's sad that your brother died. Did you know him, or were you born after?
No, he bought me. So he died within a few weeks.
Right. Oh, your poor parents. And Chris, the final question that I like to ask all my guests, if you could recommend 2 things that people could do to improve their well-being, what would they be?
I've been thinking about this answer, and I feel a little guilty about giving this answer, because I'm not always the best at practicing these things myself, but these are things I do believe in, and I try hard. But I think, and this is probably something that my partner Kate always tells me, you got to celebrate your wins.
Yes.
And no matter how small they are, and spend more energy on celebrating these things than the energy spent on dwelling on your maybe not failures isn't the right word, but maybe your mistakes. And that's been important to me over the past, I guess, 18 months. And the other thing, I guess, especially as I get older, is learning to listen to my body. And if it's telling me to slow down, then I probably need to slow down and not try and push through it, and give myself some time. And again, that's a work in progress.
Yeah, I think they're very good tips. Chris, thank you so much. It's been a real pleasure to chat to you about one of my favourite topics in the world, and that is animals. So I hope you have a good day.
I will. You too.
Thank you for listening today. I hope you found today's interview interesting or inspiring. If you did, please share the podcast and tell your friends about it. And if you could take a minute to leave a rating on Apple Podcasts, it will help people find my podcast. If you would like to subscribe to Amanda's Wellbeing Podcast, you can subscribe on all good podcast providers like Apple Podcasts, Spotify, Stitcher, Spreaker, Overcast, iHeartRadio, and Google Podcasts. You can also subscribe on YouTube. Simply click the red subscribe button there. Please follow me on Instagram and Facebook, and check out my website at www.amandaswellbeingpodcast.com. You can contact me there via the contacts page, and do feel free to suggest topics you'd like to learn more about and people you'd like to hear interviewed, and I will do my best to deliver that to you. Producing the podcast is a labour of love. It has become my full-time job, to which I dedicate a lot of time, money and effort. If you enjoy my podcast and would like to support it, I would be so grateful. You can make contributions via my Patreon page or via PayPal from the support page on my website. I'll put a link in the show notes, so please do check it out. Another way you can support my podcast is by purchasing a book from the book reviews page on my website. If you click on the Amazon link there, at no extra cost to you, I will receive a small commission when you buy a book. Thank you very much for tuning in. Eat well, move well, think well.